We do a cardio cognitive class. We're doing a TRX class this month, where you kind of hold the things that hang from the ceiling. We're doing a couple dance classes this month, and strength class with Lori. And what am I missing? We're going to have some speakers come. We'll talk about that more towards the end. Anyway, you need to find something that you enjoy that pushes you on beyond your perceived exertion. So people say, should I get a boxing bag for my basement? Sure, that's great. But after 10 punches, if you're tired, you need someone to push you. So we do have people that Zoom our boxing classes with us and some of our other ones when they can't get there, and that works well because you're still, you're still kind of following the people in the class and getting some of that, I think, camaraderie from the people. But whatever it is, it needs to be something you enjoy and something that really makes your heart rate get up, and when you're done, you say, wow, that was a workout. And then, you continue that program, whatever it is that you find that you enjoy, that to help you work out. And then, maybe, like I always say, it's like a dentist. Most of us go to the dentist every 6 months. If you have Parkinson's, it's probably important to follow up with your PT every 6 months, just again, to get a baseline. I have people that do it, and sometimes I say, you're fine, keep doing the boxing. Sometimes I say, this is what I'm seeing, let's work on that for like a few weeks, and then, get back to it. So, there's the motor symptoms. All right, non-motor. We're going to be here for a few hours. There's a ton, and don't let that freak you out, because not everybody gets every non-motor symptom. But I gotta make this one smaller again. I don't know why it's doing that. Oh. Click. All right. Non-motor symptoms are sometimes overlooked because they're not seen. And so you might go to the doctor years ago and say, I can't really smell things anymore. But you're probably not going to say, oh my God, you have Parkinson's, because there could be other reasons. Or constipation. They often show up well before the motor symptoms. So that, for example, loss of smell, constipation, anxiety. So this list here is from, let me make it a little smaller again, so that it fits. Okay, so this is from, this is Dr. Alskog. He wrote a book called The New Parkinson's Disease Treatment Book. It's really good. It's got a lot of good information in it. So he says, I'm going to go through the list and then I'll tell you. So these are subjective symptoms that are reported by patients that may respond well to carbidopa levodopa. So anxiety, panic attacks, restlessness, a feeling of inner tremor, like you feel like you have a tremor, but maybe nobody, like your whole body's shaking, but when you ask somebody, they say, no, I don't see it. I've had someone tell me that before. Fatigue, which can be caused by so many different things, a lot of these things. Shortness of breath, which, if you have shortness of breath, you've got to rule out other more emergent things, but that can be something that if it is caused because of the Parkinson's disease, the carbidopa levodopa will resolve it. You need to get cleared first for other things. Cramps, sciatica or other pain, tingling, increased urinary urgency, hot flashes and sweating, poor concentration, and slow thinking, or bradyphrenia it's called. So according to Dr. Alskog, many of the above symptoms have an all or not response to an adequate dose of carbidopa levodopa. And so it's tough because a lot of those things can happen for so many other reasons too. But if it is truly because of your Parkinson's that you're experiencing those, he says that the right dose of carbidopa levodopa will resolve it. And that may change over time, down the road, 5 or 10 years. You might, if you start to get some wearing off time, you might have to, obviously, you need to just keep working with your doctor to adjust your medications. This list is from ParkinsonsUK.org. I think they're all on here. Yeah, it's at the bottom. This one you probably can't see. Pull it up a little bit. There we go. There we go. And they have actually a really nice website, which It comes up first before the Parkinson's Foundation. But this is a list. Again, not everybody has everything, thank goodness. But so eye problems, foot care, foot problems, pain, mouth and dental issues, mild memory and thinking problems, anxiety, dementia, depression. Don't worry, the next ones are going to help you with some things you can do. Hallucinations and delusions, fatigue, low blood pressure, bladder and bowel problems, restless legs, skin and sweating, sleep and Parkinson's, eating, swallowing, and saliva control, speech and communication problems. Okay, so where are we? All right. Isn't that cute? Okay, so I just kind of, there's so many things. I just stuck to the things that I think that I can give you some good information on. So foot care. So dystonia is it says movement disorder. It's a problem where the muscles tighten up and your toes curl or your foot can kind of twist a little bit. And the muscles become tighter and shorter and harder to stretch. So when I read about this in Dr. Elliscott's book, and he says again that most times the carbidopa levodopa can help with that. I've had people come in with that, and we've done some, first of all, we checked out their shoes. There wasn't enough arch support in her shoe, so we fixed that. I gave her a little thing to put on her foot to support the arch support. We did some soft tissue work and some stretching. I showed her how to stretch her toes and the arch of her foot, kind of like some of the things you would do if you had plantar fasciitis. And so we worked on that. And then as far as footwear and foot care, I cannot tell you how many times people come to see me and their shoes are falling off their feet. And sometimes that happens because people have swelling that goes up and down during the day, but for the most part, you want to make sure that your shoes are nice and snug. Not too tight, but snug enough where you can walk. Because if you're someone with Parkinson's, your movements are getting smaller. If you're not picking up your feet as much, you should come see me. But you should also wear shoes that fit you correctly. Because if you have shoes that are way too big, you're going to have to shuffle just to keep them on your feet. And I know, do you have you got your Zebas on? So I'll lift my shoe up. This is a Kizik shoe. So the back just pops up and down like this. So I just shove my foot in there. And I don't have to struggle. Bob has his on. I have them because I'm always in a hurry and I can just run out the door and shove my foot in there. He's got his.
What kind are they?
They're called, mine are called Kiziks, K-I-Z-I-K, and his are Zeba, Z-E-B-A, and we can get that information to you.
Get them on Amazon.
You get them, yeah, you get them online, and it's free shipping, free returns. I had one guy that I said, your shoes are too big, so his wife got him a pair, and she said, what size do you wear? And he told her, and they were way too big, so I said, you need to get a different size. So they sent them back. I got my new ones. Those are still way too big. He always got his shoes way too big because he had a hard time getting them on his feet. So the third attempt, we finally got the right size. But they didn't have to pay any ship. It was fine. They just kept sending them back, and they kept sending them the next size down. So we got him set up with the right size shoe. Yep, and so sometimes even because of some people have diabetic neuropathy along with Parkinson's, some people have neuropathy for no reason, apparent reason, where your feet, maybe you feel like you're walking on marshmallows or you just don't feel the floor like you should. That's another very good reason to make sure that your shoes fit nice and snug, to give you that sensory input when your foot hits the ground.
With the shoes, this has just been my experience, they also have diabetes and
Yes.
diabetic neuropathy. I also am blessed with the high instep, so shoes that tie or shoes that have Velcro, they won't stay tight. Even if I double knot them, they come off.
Well,
So I've had pretty good run with black Skechers, but my foot doctor, who I go to see, he's right here in Canandaigua. He showed us his book, and they have all the different shoes for the different conditions. And I guess the insurance, he said your insurance will cover the entire cost.
Of the,
Not of the sketches, but of the ones in that catalog. And
yes, yeah, there
So
is
that
insurance
might be
will
something.
cover shoes for people with diabetic neuropathy or different things like that.
Maybe, but if you go to a podiatrist, they may have that same plan.
Yeah, yeah. Okay, thank you. So now, look at that, isn't that cool? We're gonna all get up and do that?
I used to do that when I was 15.
You did? I never did that. So pain, okay, so some people have pain because of rigidity and tightness in their muscles. And, you know, it could be because you have arthritis or, you know, things that, stenotic, maybe you have very severe stenosis in your back that is not because of the Parkinson's that you're dealing with, or knee pain, or whatever it is. Stretching is key. I recommend for some of the people that come and see me with this really, really tight rigidity, or they're having a really hard time turning their head, or when they're walking very stiff. I say, you know, you need to try some, I like the microwavable heating pads that you can just toss in the microwave. And I have one that wraps around my neck and covers my shoulders, and it feels like a big hug. Someone's giving you a big hug when you put it on. But those are nice because they cover a big area. And I say do that for 20 to 30 minutes 3 times a day, along with your stretching program. Go treat yourself to a massage once in a while if you don't mind massages. I know some people don't like them, but they're crazy. No, I'm just kidding. And then we have the PWR Moves, which is the program that we can do one-on-one and covered by insurance. Or we also have a PWR Moves class that is done in various positions. Like this is actually one of the moves from PWR Moves. So we do them and we work on stretching. We haven't done that one. Laura, you want to put that down for?
Right.
See how many people. Let's see if the coaches can do it first. Yeah. And then, okay. So, all right, constipation. So, diet, hydration, and exercise can help reduce it. You know, with the Parkinson's, you have that slower motility in your gut. So I just wanted to, if I can get through this really quick, I want to tell you about a case study that was done. This was a 73-year-old woman who was diagnosed with Parkinson's disease, I think 6 months prior. She was diabetic. She had chronic kidney disease. She had hyperlipidemia. She had breast cancer, had a double mastectomy, and she had hypertension. So one of the things she was experiencing because of her Parkinson's was a loss of smell. So she'd been adding a lot of salt and a lot of sugar, eating things with a lot of sugar, because she wanted the flavor. She couldn't taste anything. She had, along with that, she had decreased her fiber intake, decreased her intake of fruits and vegetables, a decreased water intake, and she had been experiencing pretty severe constipation and acid reflux for 3 weeks. So they ruled out, could it be something else, and they decided that what they were going to do was a dietary intervention. So, and she stuck to it, so they did increased consumption of vegetables up to 5 servings a day, increased dietary fiber to 30 grams a day, increased her protein consumption, decreased her sugar consumption, increased her hydration, so they were accompanied by symptomatic relief of acid reflux through apple cider vinegar. They must have used that, and then and deglycerinated licorice, DGL. Do you know what that is? I don't. They use that, as well as probiotic magnesium citrate for constipation. She had complete resolution of constipation and 50% improvement in her acid reflux after 5 days, and complete resolution of all symptoms after a month. So, diet can be pretty powerful.
This was a naturopathic treatment of gastrointestinal dysfunction in the setting of Parkinson's disease. That was the step. It was a case study of this woman. So there's just getting a list of things that are high in fiber and get moving and drink some water. And then vision can be affected. So in general, we need more lighting as we age anyway. Eyewear and posture, we'll talk a little bit about that. Some people might experience dry eyes because your eyes blink less. So if you are somebody who has forward posturing or your head is down, that's going to affect where you're looking in your glasses. So you might be looking above your glasses, or you might be looking out of the bottom of your glasses, which if you have progressives or bifocals or trifocals, it's going to affect your depth perception on stairs. So they did find that even people, a study that did it's best to get single lens glasses, which I know can be a pain in the butt because then you have to have your glasses that you see out of and you have to take reading glasses everywhere. But they did find that people with single lens, it was a reduced fall risk to have single lens glasses versus the bifocals or trifocals. But posture can affect it obviously because it affects where you're looking through your glasses. Lighting. As we age, the tiny muscles that control your eye pupils size weakens. The pupil becomes smaller and less responsive to changes in light. That's why people in their 60s need 3 times more lighting than somebody in their 20s. Smaller pupils make it more difficult to see at night. And then we talked about the dry eyes because of less blinking, and that's why sometimes people have a little bit of problem with drooling, and that's because you're not swallowing as much as you should. And then, dual tasking. He's walking and he's reading a book. I don't know if I can do that without running into a wall, but he's doing pretty good. Dual tasking and aerobic exercise. So, to help with cognition, get regular exercise, eat a balanced diet that includes a variety of fruits and vegetables, stay socially engaged with friends and family. That's from the PD UK, Parkinson's Disease UK. And then there was a study from NIH. Mind-body exercise is a therapy that combines concentration, breath control, and physical activity is beneficial for improving practitioners' brain and mental health. Mind-body exercise such as Tai Chi, yoga, dance, and Pilates can improve cognitive performance in older adults with or without cognitive impairment. We do a cardio-cognitive class 1 day a week. It helps people that have a harder time building up their endurance and they're getting their heart rate up because maybe they can't move very fast. So we get them on bikes, on the treadmill. We have a treadmill with a harness. We do some stuff in the clinic to get the heart rate up, and then we throw in some fun cognitive tasks in there. And then this one here is just in general, aerobic exercise alters brain function and structure in Parkinson's disease. Oh, that was part. A randomized controlled trial, that was it. So aerobic exercise alters brain function and structure in Parkinson's disease. So, period. All right. And then, okay. So I already talked about the Kizik's and the Zebas. If you don't like ordering online, I suggest go to an old school shoe store like David's in Canandaigua or MedVed in Pittsburgh, where somebody's actually going to come out and measure your foot, help you find the right shoe. MedVed has a little track, and so I often recommend people to go there to get fitted for a shoe. I have the walking poles here. Did you bring those papers? Lori's got some informational papers on the walking poles and research they've done on them. But by adding those to your walking routine, they've shown that you increase your step length, your gait speed, your posture, because these were designed by an occupational therapist. She designed the core grip. So you're holding the grip and you're kind of pushing down on it as you walk. Every time you plant the pole, you're engaging your core muscles. There's a tip on the bottom. It's a balance tip. And so it helps with stability. Each pole can hold up to 250 pounds of pressure. So if you're somebody that has joint problems, you know, you can really unweight your joints a little bit and maybe walk a little further than you would without the poles. If you're somebody that wants to lose weight, you burn 20 to 40% more calories when you use the poles versus walking without them. You're also engaging 90% of your muscles instead of 50, because you're getting your core and your upper body when you're walking with the poles. We have those at the clinic, and I know that in the past there's been some, you can apply for some support to get. They're not too expensive, but if you needed additional help. And then I also have forms that you can send to your insurance and try and get reimbursed. I've had people get reimbursed partially. It was a lot of work, but they did get it. Microwavable heating pad, we talked about that. Medications, again, all your symptoms, whatever they are. Taking your meds on time every time is huge. So I just recently set a phone alarm for somebody. You can set it repeatedly, so every day when you're supposed to take your medicine, it goes off, and then you take it. If you leave the house, make sure you take some carbidopa, levodopa with you, so that when it's medicine time, you can take it, and you don't miss a dose, or you don't take it too late. So you can set your phone alarm. For home, there's something called a med minder, which they had on the news one time, which is a really neat, it pops your pills out for you. And then if you live alone and you don't take your medicine, it'll call your loved one and say, hey, Joe didn't take his pill at 7. And then your loved one will call you and say, hey, take your pill. So, and it's got like a video thing too, so you can see the person, you can have a picture scrolling by. So there's some neat technology out there. I wanted to have this calendar for you. This is our April. April is Parkinson's Awareness Month. We're doing a ton of activities, free of charge. So we're going to have on the 11th, we're going to do a dance class. We're going to have one towards the end of the month as well. I just don't have the date yet. We're going to have some people that do a speech and communication program come in. We're going to do a couple trail walks over on the Auburn Trail in Fishers. And we're going to do a exercise pole class, which we did way back before COVID. You guys came to that. And we're going to do a PWR moves class one day. Lori's going to do a TRX class. So I will get this, I'll have, maybe, who do you email? Once I fix it up and get it.
Can we put it on the website?
Yes, please. And then this Saturday, we're going to be doing some free screening from 10:30 to noon. We're just going to do some quick testing because we're going to do we're going to do a 5K. Maybe. I mean, we are. June 1st, I rented the pavilion at the park in Victor on Brace Road. We're going to have, everybody's going to, this weekend and next week, people are going to set their goals to what they want to do. Maybe you want to walk 1 mile, maybe you want to do a half mile, maybe you want to do 3.1 miles. We're going to do it right there at the park, and you can get people to sponsor you. We're going to make t-shirts, and it's going to be lots of fun. So that'll be June 1st, that'll take place. And all the way up until then, we're going to be working towards building up to it. So we'll get all that information out to you. That's ready, set, go. Set your 5K goals. And if you have any questions, you can call. That's it, I'm done. Any questions?
Oh, you said with the shoes, you help the individuals get the right size in that, or like you said, that person had to keep sending them back?
Yeah, well, I was
Or
there.
do they do it themselves?
They did send it back themselves. I mean, it's pretty simple. It's pretty straightforward. A lot of times you just have to, they send you a link and you can take it to the post office and they print the label for you and you just stick it on the box.
Oh, yeah.
But yeah, I mean, I helped them because I got there and I said, your shoes are still falling off your feet. So fortunately they listened and kept sending them back and we did finally get the right size. Yeah.
Thank you.
Yeah. And they make all different colors.
But I would suspect if you went to a place like Davidson's and were looking for shoes, they would measure you. They would give you what your shoe size really is.
Hard
Yeah.
to find
right.
any place that
That's right.
actually measures.
Yes.
Yeah. And these Kizik's and Zebas, they're so popular now that I can't imagine that some of the shoe stores wouldn't start carrying them soon. I don't know.
Question.
Yes.
These shoes go on so easy, but are they still tight fitting?
Yeah, so you just have to, you tighten them up to how you want them. and then they pretty much stay that way. You know, you may have to retighten them every now and again, but for the most part, they do pretty good. And there is good arch support, so, and they do make them in wine. Yes?
You mentioned vision.
Yes.
I've suffered double vision times.
Yes.
And there are exercises you can do for that.
Yes, I think there is. I would probably send you to, I mean, have you talked to your eye doctor about that?
Yes.
Yeah, did he give you some tracking exercises? Like sometimes?
I looked them up online.
Yeah. Yeah, I would refer you to your eye doctor or a therapist that does more with the eye tracking. We do have a vestibular therapist that works for us that I would probably have her help you out. But yeah, I think there are some things you can do for that. Do you know any other things?
I mean, if the exercises don't work, generally what they will do is the optometrist will put prisms
Yes.
in your glasses, so now your vision is focused.
Yeah, I do it,
Yeah. If there are no other questions, Trish and her cookie and her healthy brownies. There are no calories.
I didn't say that.
And then at 2 o'clock we will split up into our two groups. The people with Parkinsons will stay here, and the care partners will go upstairs, I believe.
Third floor,
Third floor.
at the end of the hall.
Yeah.
Is there an elevator?
There's an elevator.
Thank you, Robin.
No problem.
And again, I will put in a pitch for exercise. If you look at the whole Parkinson's disease situation, there is nothing pharmacologically, by that I mean medicines, that you can do that slows the progression of the disease. The only thing that has been shown to slow the progression of the disease is the sort of thing she's telling you to do. Physical therapy, activity, repetitive exercises have actually been shown to slow the progression of Parkinson's disease. So, although as a physician I push drugs, I recommend pushing activity even more than pushing drugs.
Stu, just want to mention, next month we're doing a chair Tai Chi.
Yes, so our April session is going to be chair Tai Chi, so you don't have to get up. But I assume if you wish to, that you'll be allowed to stand up. Yeah.
Where's the physical therapy place that you're from?
So we're in Victor, you know where Kitty Van Bortle is?
Yes.
We're just down the road from that. We're on that side of Victor.
And what
You
are
know
you
where?
called?
What's that?
What's it called?
Safe at Home Physical Therapy. There's some information back here
Okay.
on the table. There's some bags if you want to take bags. The information has all our phone numbers on it. You come to the clinic and see us, or we can come to you. And it's New York State is direct access, so you don't have to have a referral to come. You come, we evaluate, and we send it to your doctor and have them sign off on the plan of care.
They're in back of Mark's Pizzeria on 96.
Okay, I know where it
The
is.
little building in back.
And I do know that the physical therapy department, Thompson, also does programs specifically for Parkinson's disease. Is the Y still doing?
No.
The Y is not. And if you live in Syracuse, there is a Safe at Home Physical Therapy in Syracuse.
Is there?
Yeah.
I did not know that. Interesting. I know there's one in California.
And actually, the program will be delivering at some point out of Cortland, doing a device that seems to improve muscle tone. They actually now have the machine, and the program is in Syracuse.
Is it like a vibrator? The
It's a
vibrator?
vibrator.
About the gloves.
The gloves aren't there yet. The only place I know where the gloves are is in the Virgin Islands. One of our members who lives in the Virgin Islands in the winter, we have Zoomed with, and her husband has the Parkinson's. She has a friend who's an electronics expert, and created the gloves for him to use. And so far, after about 3 weeks of the gloves, he has regained much of his sense of smell. Rather interesting.
Yes?
Stu, you mentioned the physical therapy, stay at home, some other place as well. You talked about one being in one big.
Yeah, Thompson Hospital. I know that at the group of Cortland State, the physical therapy team there is training in the power and such, all the Parkinsons. So you might contact the physical therapy program at Cortland State, because I know they are actually trying to recruit patients, and the fellow and this device that I talked about, where it vibrates the legs, has been shown to, over a 12-week course, to substantially improve gait. So I would get in touch with because I know they've recruited about 10 patients so far.
Yeah, Jeff Bauer.
Yes.
Yeah, I know about what he's doing.
Yeah. Yeah.
Okay.
And he is now linking with a program at Cornell.
Yes.
Yeah.
Right, and Craig maybe can.
Right.
Actually
And we will be, in the next couple of months, be sending out getting that information to everyone.
Great.
Yeah.
What was that thing they were talking about?
Okay,
So-
time to eat.
Socialize.
I've seen in the past, because I used to get and they'd be calling for the one call. But I didn't know there was one.
And so I've just been so busy, I haven't really had a chance to.
Mary, how are you? Good. How are you doing? Good. Good. Yeah. You're going to come back to the dancing class? Yes. Good. Good. I heard you really enjoyed it. What? I heard you really enjoyed it.
I did, yes, definitely.
Good.
It was good. What kind of dancing? What did they do? The girl who's conducting it, she's a PT person, but she brought her own music, and most of it was from the 80s. Great. And she had a routine. She put together that music.